I'm Carla Schimmelfinnig, registered physical therapist, and welcome again to InjuryGuru.com. And this is the fourth video in the lumbar exercise program number 1. This exercise is just called a prone alternate leg raise, and that simply just means laying on your stomach on the floor or on your bed and raising a straight leg up toward the ceiling. So let me just show you what that one looks like. So for this exercise, again, like I said, it's laying on your stomach. You can prop yourself up on your elbows like I am, or just lay flat like that. And it simply is just keeping your leg straight and raising it up toward the ceiling and letting that down nice and controlled and raising the other leg up toward the ceiling. So that was 1. This is 2, 3, 4, and so on. With this one, most of my patients are actually surprised that this exercise is so difficult for them when I first have them try this. So if you're one of those people who have been having back pain and you've been having this for a while, you do have limited motion in that back, so bending up and back, or this exercise is and was pretty difficult for you when you first started, then you will have probably a little bit of trouble with this exercise. Now, I want you to raise those legs as far as you can fairly comfortably. When you first start doing this exercise, it's probably going to give you some discomfort in that low back. But if you keep going, you complete the sets and repetitions, and you notice that your pain is less the more you do it, then that's definitely the sign to keep going. That's your body telling you that is what you need, and just keep going. A lot of the times my patients aren't able to raise that leg very far off the floor or the table, and that's fine for right now. So if you do have that limited back extension, you're going to find that this exercise is a little difficult to start with. The more you do that back extension laying on your stomach or standing, then the easier you'll find that this exercise is. Also, if you have been dealing with this back pain for a while, you have some weakness. So you probably have some weakness in the back of that thigh and in the glutes or in the rear end. So the longer you do this exercise, the more strength you're going to get, and then the easier it will seem. When you do this exercise, I want you to do 3 sets of 15 to 20 repetitions at each session that you do it, and I want you to do 3 to 4 sessions a day. You can take a 10 to 20 second rest in between each set each time you do that during the day. If you have to go to work, and I know that this can be hard trying to find a place that you can lay down to do this exercise. So if that's really not doable for you at work, then just make sure you get this exercise in the morning before you go to work, as soon as you get home, and again in the evening, sometime before you go to bed. Don't forget about that ice or heat on that back. Remember, if this has been going on for several days or anything longer than that, then that ice or heat, that preference is really up to you. Whichever one just gives you better relief of pain and makes you feel better. 15 to 20 minutes is all that's needed for either of those, and you can do that 3 to 4 times a day as well. So now you have all the exercises you need for this first exercise program for the low back. It's just 4 simple basic exercises, but I really need you to do the sets and repetitions and the frequency throughout the day that I've described. That part is really, really important. I want you to commit to this for at least 2 weeks, like I mentioned in the beginning. And as soon as you find that you're doing better, you're having less pain, you can do those things that you need to do and want to do, you can sit for longer periods of time, stand for longer periods of time, then I want you to go on to the second lumbar or second low back exercise program really quickly. If you get to the end of this program at 2 weeks and you find that your pain is gone and you're just doing much better, then great, I'm really happy for you. Just keep going on with life. Make sure that you are using that lumbar support. If you did purchase one of those, make sure you're using it. It is really worthwhile and can help prevent further episodes in the future. If you get to the end of this program and it's that 2-week mark and you find that there is little to no change in your pain, or worse yet, your pain is even worse, then don't waste any time. I want you to go and see your doctor, or just go right to the physical therapist if you can do that. It may be that You just need a little more intervention from a therapist or from the doctor. They can do things for that back to get you going, give you a kick in the right direction. I just encourage you to get going, get started, and let's see what we can change. If we can get rid of that back pain for you and get you back to doing all those things that you need to do on a daily basis and that you really want to do on a daily basis.